If I could go back to all of the doctors in my life who have missed or misdiagnosed or ignored endometriosis, I would tell them that they were fucking wrong.
I waited about 10 more years before I finally found a doctor who said, no, that's not a normal pain.
It turned out that the endometriosis was extensive.
And it wasn't until I went to my now surgeon that I realized how serious it was.
I had my second surgery and she was able to save my leftover. It was matted to my bowels. It kind of pulled my intestines out of place a little bit. She found a lesion, huge lesion on my bladder. There was some on my right side.
There was a lot in the rectal lining. He had never actually seen endometriosis that was so deep.
The surgeon said that it took her almost like an hour and a half just to reestablish my anatomy. I had 3 surgeons. There was a urologist, a colorectal surgeon, and then the endometriosis specialist. And the 3 of them worked together throughout the 6.5-hour surgery to remove as much endometriosis as they could find.
I don't have IBS, I have endometriosis all over my bowels because I was 36 when I got diagnosed and it had, I don't know, 20 years to grow inside my body.
I had my menstrual cycle when I was 9 years old. I've had cramps ever since I was 9 years old.
My periods came on very early. I believe I was 10 when they started. They were very long, heavy, painful. So my first symptoms of endometriosis actually came with my first period when I was 11. My periods were so heavy and so painful. So we went to a gynecologist when I was 11 years old.
I mean, when I was younger, I saw gastro doctors, I saw kidney doctors, I saw doctors for every gamut of whatever they thought was wrong with me based on my symptoms, and it was all just endometriosis.
I had my first GYN visit and it was just told to me that, you know, most African American women just deal with having heavy menstrual bleeding as well as the symptoms.
At the time, no one mentioned endometriosis, which would become a trend throughout my life.
When I first went to the gynecologist, I was telling her about the pain I was having, and we began to notice that I started physically getting sick every time I got my period. I would be fainting. It wouldn't matter where I was. All of a sudden, I would feel cold sweats, I would get tunnel vision, and I would just go completely out.
I had such bad left side pain. I was, despite a very aggressive food allergy diet, I was so bloated. I could only wear scrubs.
I would bring up to them, I get cramps and then I vomit. I have fainted while trying to take a shower. If I was driving home from work, there were times that I had to pull over while on 95 to throw up because the cramps were so bad.
I had seen 14 gynecologists and had 7 MRIs and 2 CAT scans.
I went to many doctors that gave me more STD screenings.
And she would always question me my sex life. Are you sure that you don't have more than one partner? Are you sure that your partner isn't having intercourse with other people? Are you using the protection you should be using? Because it sounds like it could be an STD.
In addition to those 14 gynecologists that I've previously mentioned, I probably have seen 6 others on top of that, so 20 gynecologists between when I was 13 and when I was 35. I've seen at least 2 gastroenterologists, And I've done a lot of, I've seen every functional medicine specialist, acupuncturist, chiropractor, osteopath that deals in chronic, lifelong pain conditions.
I woke up from a very deep sleep with the worst pain I've ever had in my entire life. And I went to the hospital the next day because I was still in quite a bit of pain. They gave me an STD screening, a pregnancy test, a sonogram, transvaginal sonogram, a CAT scan, and doped me up and sent me home. The only thing that they found was a teeny tiny little cyst on my left ovary and said, well, there's the problem. We have solved everything. Off you go into the world.
All of the medical community couldn't make any sense of it.
In the hospital, I was asked a lot of times if I was a recreational drug user. They would point out my body weight and that I was skinny, and they assumed it was because of drugs. And it wasn't. It's because I couldn't eat. It's because I was too sick.
And they brought me down to the emergency room, and the woman saw me crying, and I started hyperventilating because I hurt so bad. And the nurse looked at me and said, nobody cries this much if you're in that much pain.
Don't tell me my pain isn't real, because if I can't sit down, I can't function, I can't lean on one side, like, this is problematic. There's something really, really wrong.
I had another doctor ask me, since I was the youngest of four children, if I was looking for attention from my parents, and that's why I was doing this.
The gynecologist that I was seeing, that I saw for a couple of years, and I would tell her I don't feel well, I have pain with my bowel movement. Oh, everybody has that. No, they don't.
From there, and from that point on, I didn't want to continue going because it sounded like no one believed me.
I knew for the longest time something was wrong. I felt like I had little gremlins living inside of my body, and I would try and get help, and nobody would listen to me. It was so, so frustrating.
Throughout my adult life, I had brought different symptoms to different gynecologists and doctors, and always been told, like, you're fine, that sounds fine, like, take more Advil for the cramps. And that attitude didn't really change when I started working with reproductive endocrinologists.
I really started to believe a lot of this was in my head. I actually had one doctor who told me to learn the difference between pain and discomfort.
And I went to my doctor. I was seeing a midwife at the local health center. She prescribed me, I believe it was tramadol. I started on tramadol. And it kind of went downhill from there because, well, obviously the tramadol stopped working, and then she prescribed me something else, and when that stopped working, et cetera, until I got to Vicodin. She would go to her little medical reference book and look up different painkillers she could prescribe me just to, quote, take the edge off.
So I was telling my doctor about this, and she thought, oh, let's put you on birth control to regulate this. She had put me on 3 different birth controls.
She didn't really look to see what else could be causing all these issues.
She didn't want me to get a second opinion at this time, because every time I mentioned that, she kept saying, you know, you're too young for surgery. It's just going to grow back anyways. All they can do is hormonal treatment for you to try to solve this problem.
My husband and I started trying to conceive when I was 28. We quickly learned that we were infertile. I had an unexplained diagnosis for the 3 years that I was working with reproductive endocrinologists. Now, anyone out there with unexplained infertility, like, you know the pain. It's just a horrible, horrible feeling. You don't know why this is happening to you. You don't know what's happening inside of your body. You feel like something is really wrong, and no one can tell you what it is. And for me, it turned out that it was endometriosis, and no one was diagnosing it, even doctors at the top clinics in New York City. I met my husband, Evan, back in 2001. We got married in 2006, and we started trying to conceive. We tried for a year with no success. I was not having regular periods at the time. We went to see an OBGYN who prescribed Clomid to me, and we did that for 4 cycles. I got pregnant on my 4th cycle, but unfortunately we miscarried at just about 12 weeks. The only time anyone mentioned endometriosis was after my first IVF cycle, when I grew an endometrioma that was the size of a grapefruit. And they said, oh, that's an endometrioma. But they didn't say, that's an endometrioma, and you have endometriosis, and this could be a really huge problem. The reproductive endocrinologist perspectives at 3 different clinics in New York City were all, we don't want to operate, it doesn't improve outcomes, just do more IVF. We chose not to do that, and I am so thankful that we chose not to put more and more drugs into my body, which was very, very sick. After IVF, my symptoms got much, much, much worse. By about 2 or 3 years after IVF, I was having chronic fatigue, chronic pain. My periods were debilitating. And I went to a new specialist. We went to see our first reproductive endocrinologist, and I was officially diagnosed with PCOS, was put on metformin, and put on Clomid again. I got pregnant for the 2nd time, right when we had moved to North Carolina, and unfortunately had my 2nd miscarriage at about 6 weeks. And we started going through the gauntlet of treatments. We did Clomid again, we did Femara, we did IUIs, we did 2 IVF cycles and 3 FET cycles, and they were all unsuccessful except with 1 chemical pregnancy with our 2nd IVF cycle. So we had started with our diagnosis of PCOS, and unfortunately when our last FET cycle failed in September 2013, I was given the diagnosis of unexplained infertility, which I feel was a hard pill to swallow because we had tried everything and took all the medicines for the previous diagnosis and none of it worked. But when we stopped treatment back in 2013, my periods have gone back to being very heavy, very painful. Nobody except my current OBGYN here has even brought up endometriosis as a possibility. I feel like we wasted 7 years and didn't get anything out of it. I mean, you put all this time and this money, and people aren't willing to explore all the options with you. And, you know, it's hard to think about. It's really hard to think about everything that I've been through and how things could have been different for my health, for my family, for everything.
And I found a book online written by Susan Evans and Deborah Bush, and it was called Endometriosis and Pelvic Pain, and I thought, well, maybe this.
When I did my own Google research, I found endometriosis, and I asked my doctor about it, and he said that I was too young to have endometriosis, and it doesn't affect people the way that I think it does. It only affects fertility.
And I happened to open up a Cosmopolitan magazine, and in the back of the magazine was this tiny little chart of random pelvic pain, and it listed a bunch of STDs, and at the bottom of this chart was endometriosis. God, that's it. That's what I have. And
a family friend worked at Rutgers, and she's like a sleuth gynecologist. She doesn't actually treat patients. She randomly called on the phone, and she was like, well, I don't know. I don't really know what's wrong with you. I just came across your chart. I said, well, that one from Top Chef has endometriosis. Do you think I could have endometriosis? And she was like, well, because the one from Top Chef has it, obviously she's referring to Padma Lakshmi, everybody now thinks they have endometriosis. It's become the hot thing to have endometriosis.
I would say to them, my mom had endometriosis. Are you sure this is not something I can have? Yes, we're sure. Definitely not.
There was a website, I believe it was EndoKnows.org or maybe .com. I don't think it still exists, but they had a checklist. You could answer a series of questions and rate your pain on a scale, and it gave you a whole printout to present to your doctor. And all the information said, yes, I had endometriosis. So I went back to my doctor and said, ha-ha, I am well equipped today. And she took one look at it and said, that's not you. So that absolutely is me. What do you mean that's not me? I fit every single criteria on this page. That is exactly me. No, that's not you. Okay.
There's so much information out there that if you are concerned about something and you're my doctor and I come to you and I say, doctor, I think I might have this. You know, if you're going to tell me that no, that's not possible, you know, you're really not listening to me. You need to listen.
I think for my first lap, I kind of was in denial because when I was talking to the physician, he was telling me like, oh, it's going to be nice and quick. It's going to be 30 minutes. You'll be able to go back to work and to school and you won't have no problem.
I decided to start my journey to find another doctor for a better answer. I went to my mother's doctor who dismissed me. So, well, how would you like to continue this conversation? So, well, we're going to have to go in for surgery because I don't know what else to do.
After I had my first lap with the first surgeon that I had, it was just like he said. It was 30 minutes. I came out. I went back for a follow-up visit a week later, took a sonogram, and I thought all my worries was gone.
I went in for my first surgery, and I was quite covered in sticky, webby grossness. And she left everything in there and sewed me back up. And when I came to, she said, well, you have endometriosis. I said, well, no shit. She's a very well-known doctor throughout Westchester County, where I'm from, for delivering babies. And, you know, that's great. But there are millions of women like me that have other issues going on. I needed help. And she was very quick to dismiss me on many, many occasions. I came into the office hysterically crying months after my first surgery, and she said, Amanda, there is nothing I can do for you. And that was the end of that conversation.
And I started to think about how many doctors had misdiagnosed me, and obviously it goes back to when I was 11 years old, so it's basically every doctor I've ever seen in my life. Even from the beginning of our fertility journey through when I finally met my surgeon, 5 doctors misdiagnosed me. And these are specialists, they're experts in the field. Only 5 doctors completely missed this horrifying disease that was eating my insides.
I had a colonoscopy. They thought maybe it was anything else that wasn't endo. I went to a specialist who told me I should go see someone else because it was all in my head.
One doctor had written a book, and I was so excited to see that he was still in practice. He gave me 2 prescriptions, one for a Lupron-like nasal spray, and the other one for Vicodin. And he said, you can choose how to manage your pain. This nasal spray I will have to take away from you after 6 months because it's so detrimental to your health. But the Vicodin will also take the pain away.
I switched doctors. I found the specialist. So when she had found the endometriosis, I had my follow-up. I kind of discussed to her that I was still having issues, and I asked her, you know, did you look up my bowels, because I was still having issues going to the bathroom. I was still having pain during intercourse. I was still having irregular bleeding, even on the birth control again, because she had started me right after the surgery, and so my bowel movements weren't normal. I was having pain to the point where I would start crying as I was going to the bathroom. She said that she didn't look at my bowels, that she had only looked on my ovaries and my uterus, I believe. At that point, our plan of action was then to put me on Lupron. So I would say that my specialist wasn't a specialist due to her not checking my bowels, due to her just wanting to continue with medication and not looking at other options. I would also say because she didn't go into full detail after the surgery describing everything, it was just, oh yeah, you have moderate to severe endometriosis, almost as if it wasn't a big deal.
And I had no coping skills, of course, leaving the doctor's office.
When you go to see a doctor and they are constantly dismissing you, it starts to make you feel like you're crazy and that you are turning on yourself, that basically your mind and your body are at a disconnect.
I started back on a lot of different painkillers. I went to a lot of different doctors and nobody would listen to me.
You know, on some level, I wish that I didn't have my surgery because it did definitely make my pain worse. I do wish that he had the ability to say, I'm not skilled enough to work on your case.
Yeah, my wife has had surgery. She had one several years back, which was very poorly done and actually made things worse. And the doctor didn't want to hear about the pain that she still had after the surgery.
It wasn't until 10 months later I had that surgery in January. It wasn't until October when I got breakthrough bleeding, and that's when I knew that there was something wrong. And it wasn't until I went to my now surgeon that I realized how serious it was, and also I realized that my first procedure actually really wasn't a procedure and it made my endometriosis worse.
I wish I had better preparation going into endometriosis. I didn't realize that my body was so broken.
Years of mental anguish would have been relieved, years of pain.
Just so many different doctors with so many different yet the same opinions that it was all in my head. There's nothing I could do. And well, you already had the surgery. We're not going back in. We already know what it is, and we can't help you. But why? Why can't you help me? I'm dying. My ovaries are entangled in stuff, and nobody's giving me answers or support or listening.
What would I say to all the doctors? Oh man. Maybe wake the fuck up.
That I'm shocked at how negligent they are.
I would show them my surgical report and say, this is not nothing. This is not nothing. I am not making it up. You have to listen to me, and it is your job to help me.
To all the doctors out there, when someone walks in, whether they're 13, 25, look for it. Think about endometriosis as an actual chronic disorder and not as just infertility, and not as just something you discover when people want to have children.
Educate yourself. That is the most important thing, is that as my medical professional, you're supposed to be educated on this, so you should continue to get your education. I, as a teacher, I have to go back and continue to extend my frickin' master's degree for the rest of my life. I'll have to go and take courses on new information. You should be doing the same thing.
That the doctors be better educated about the patients that they're working with.
Again, it's really not that hard to go and look up something or refer me to a specialist if you don't know.
You know, not every gynecologist is going to be able to help. Few are going to be able to help someone who's seriously struggling with endometriosis.
Doctors really need to listen to what their patients are saying, and they really just need to take a step back and have a little humility and say, you know what, if I can't help you, maybe go to this doctor that might be able to help you. Your pain is real.
You know, the medical profession really needs to build their own awareness and, you know, learn about the resources that are out there for people who are struggling and be able to refer.
you know, you should at least have the wherewithal to say, you know what, this is beyond me. I don't know what you're talking about. I don't understand endometriosis, but you know what, if you think you have that, here's a list of doctors.
More damage is done by well-intended doctors or, you know, not well-intended doctors who just don't understand the disease and can't treat it.
I just want to let them know how much of an emotional toll they had played on me, because they had made me feel like I was crazy.
So when we've gone to doctors, there's a different standard of care for my wife and for women who have endo. The women who are there and who have this disease are very strong and incredible women who've gone through a lot, and they've done a lot of research, and it's incredible for them to be there to even stagger to the doctor, and there's no need to talk down to them or to be dismissive of them.
I feel like doctors think you had surgery, you're fine, life is fine now. But there's so much that comes along with it. There's exhaustion, there's pain, there's the emotional aspect.
So that the women really should just be treated as equals and as a team in terms of finding the best way to treat the disease that they have.
I think when doctors treat women with endometriosis, it needs to be multidisciplinary care. I wish doctors would know more about chronic pain and what it does to a patient, because I think that their sympathy would increase. I think that they would have a better understanding. Endometriosis causes pain, and it takes over your whole body in a way. So if you look at a person as a whole person, it takes over your heart and your soul. It causes horrible inflammation and muscle spasms, and you need more than one way of caring for a woman with endometriosis. And I think when you deal with endometriosis, you need to understand that it takes a whole team, a collaborative effort to make a difference in a woman's life. And that includes pelvic physical therapy, and that can include counseling if it's needed, and it certainly can include dietary management, and it certainly can include surgery is a huge role in dealing with a woman with endometriosis. But it isn't just one thing. There are not enough endometriosis specialists, and if we could supply the amount of endometriosis specialists we need for the amount of endometriosis patients we have, that would be my biggest wish for the endo community. And we have to do a better job to make sure a woman is able to get access to these things and to be able to pay for them as well, because that's how you heal.
I can't even imagine what it would be like if that doctor, when I was 11, was like, oh, this is serious. Like, there's something serious happening, and we need to do everything we can to help you. Like, I can't even imagine what my life would have been like.